Hello, my name is Jamie Commander, and I'm a senior nursing student at Pacific Lutheran University. I completed my senior preceptorship in the Level 2 NICU at Good Samaritan Hospital. The title of my capstone is NICU Nursing Care for the Infant Experiencing Hypoglycemia. I decided to pursue this topic because hypoglycemia was one of the most common reasons infants were admitted to our NICU. While I understood the hospital's protocol for assessments and interventions, I wanted to explore the literature to learn more about the nurse's role in caring for these infants. One thing that surprised me as I read the literature is the lack of consensus surrounding blood glucose values that warrant treatment. Because there is an expected drop in blood glucose after birth, it can be challenging for nurses to determine if low blood glucose values are physiologically normal for their time of life or if they're pathological. Because of this lack of consensus, nursing governing bodies have implemented guidelines using blood glucose values thought to provide a margin of safety before adverse outcomes occur. The importance of assessing for risk factors is something I found in the literature that reinforced what I learned in preceptorship. There are many risk factors for hypoglycemia, including prematurity, intrauterine growth restriction, infants of diabetic mothers, large or small for gestational age, cold stress, and even sepsis. Some of these factors can be determined in utero, while others are determined after birth. The NICU nurse plays a big role in assessing every baby for risk factors so that they can plan accordingly and implement the right assessments. While researching the interventions for neonatal hypoglycemia, I was pleased to find out the treatments I was implementing with my preceptor were the same as the evidence-based treatments I read in the literature. The nurse plays an important role in administering glucose gel and monitoring the infant's response. When glucose gel is unsuccessful, the nurse initiates IV dextrose therapy. While the newborn is in the NICU, the typical bonding time that most mothers expect to have with their infant is often disrupted. I found through my research and personal experience in the NICU that the nurse plays a vital role in promoting maternal-infant bonding. This can look like encouraging skin-to-skin and breastfeeding in the NICU, even when the infant is receiving IV therapy or glucose gel. Something I want my audience to take away from my poster is the importance of assessing for risk factors, attempting to prevent hypoglycemia with early feeding and keeping the infant warm, and then promptly implementing interventions when hypoglycemia is discovered. Prompt treatment is important because untreated and prolonged neonatal hypoglycemia can lead to brain injury, which can show up later in life as neurodevelopment and visual motor impairment, low literacy and numeracy, and executive dysfunction. This concludes my capstone presentation. I would like to thank my capstone advisor, Dana Zeichkin, and preceptor Kendra Wilson for the support and guidance they provided me. I hope you enjoyed my poster on NICU nursing care for the infant experiencing hypoglycemia.